Uh, yes, I am Dr. Jaitirth Kulkarni. I am a consultant orthopedic surgeon working in Fortis Hospital. I have done my training in PGI Chandigarh. I was in England also for 6 years and 1 year in Canada, where I've had extensive training in all aspects of orthopedic surgery. Currently, my practice involves hip replacement, knee replacement, and arthroscopy of the shoulder, knee, ankle, and other joints. I also treat trauma. Now, this present topic is regarding knee replacement. Knee replacement surgery is becoming more and more common these days, and it is predominantly done for addressing pain in the knee, secondary to arthritis. Now, arthritis is a condition in which the natural joint becomes worn out and becomes rough. It can happen because of old age. This condition is known as osteoarthritis. It can also happen as a result of inflammatory problems like rheumatoid arthritis or inflammatory arthritis. It can also happen as a result of injury. This is known as post traumatic arthritis. So, initial treatment of arthritis is with medications, with physiotherapy, with activity modification, and with the use of some physical devices like splints, braces, and mobility aids. If the pain is controlled by these means, we allow the patient to carry on with these modalities, with these measures in place. But many times, what happens, the arthritis continues to progress, it continues to become worse, and then gradually the medicines stop working, the physical aids will not help, physiotherapy will not help. In such cases, there are some treatment modalities wherein we give an injection into the joint. Sometimes we can also do what is called an arthroscopic washout of the joint. Uh, these are again temporary procedures, they don't give you permanent relief. So, in a significant number of patients, the arthritis continues to get worse and they are not getting any relief by any of these other treatment modalities. So, medications don't work, physiotherapy doesn't work, injections doesn't work, activity modification doesn't work, and they are not able to lose weight because they got so bad arthritis that they can't walk also. So all these things, they become it becomes a vicious cycle and patient gets more and more disabled, and the quality of life becomes very poor. So initially they may get pain only when they are you know going on outside the house and all that, or going pain with activity or pain while working. But gradually the pain becomes worse, and some people get severe pain at night also, or pain at rest also. So when the condition becomes so bad, there is no treatment other than knee replacement. So a knee replacement surgery cures the pain for these patients. In knee replacement surgery, the worn out part of the joint, the damaged cartilage is removed and is replaced by artificial bearing surfaces called implants. The implants are of different designs, but generally the shape of the implants closely mimics the shape of the knee joint itself. The success, the operation is done as an inpatient. The patient needs hospitalization for 3 to 5 days for a knee replacement. Both knees can also be done provided the patient does not have any major medical problems like heart problems or severe uncontrolled diabetes or thyroid or other issues. The patient is evaluated before surgery, the patient is evaluated by the anesthetist, by the cardiologist, and by the physicians to make sure that he can withstand all these surgeries. Routine preoperative blood tests are done. Then ECG and echocardiogram, these are also done. Once the patient is deemed fit for surgery, he is taken up for surgery. The surgery consists of changing the bearing surfaces. I can show the procedure on a model in a few minutes. I'll just show you what we do in a surgery. Okay, bring it. Thank you. ಅದು ಇರ್ಲಿ ಪರವಾಗಿಲ್ಲ. Okay. So, so this is the model of a. Not visible. Is it visible? Something is. Uh, this is a model of a knee, and this is what happens when the arthritis starts. This surface becomes very, very rough. The surface becomes very rough, and when when the surface becomes rough, the patient gets pain. So what we do is we in the knee replacement operation, removed. Rough portion is removed. It's only about 8 millimeters of bone that is removed. It's called an implant. This gets implanted on the femur. It looks big, but it's only 8 mm in profile. It's only 8 or 10 millimeters in profile, the implant. It is only this much. And this is for the femur. This is the tibia, which gets removed here. And this goes here. And this takes the place of the original implant. So this works as a knee replacement. This is how the knee works. This is for a standard total knee replacement. For uncomplicated arthritis, this is what is done. Now there is an improvement in this implant, wherein the traditional implant is made of cobalt chromium, cobalt chrome implant. There are some other newer advances in which we have ceramic coated implants. There are implants which have a coating of ceramic. This looks black in color. This is oxinium. This is manufactured by a company called Smith and Nephew, and is a proprietary design of Smith and Nephew. There are other companies which have titanium niobium nitride, or it looks golden in color, so it's called a gold knee. So that is also there. So these are the newer advancements, but the traditional knee itself does very, very well. The results of the traditional knee replacements have been so successful that almost 90 to 95% of the implants are working for minimum of 15 to 20 years. So the implant survival rate is 90 to 95% at 20 years for all major designs of knee replacements. And in our practice also, we are getting similar results. So knee replacement is a very, very successful operation. Once the surgery is done, the patient does not have any pain, and he need not continue to do exercises or physiotherapy or take painkillers. His quality of life is improved dramatically, and it also helps him to become more physically active. So he has overall improvement in his general medical situation, like control of diabetes or control of blood pressure or exercises for the heart. All these things can be done much better once the pain is relieved. Now there are also some more improvements that have happened recently, wherein we have a computer guided knee replacement, wherein the surgery is done with the help of a computerized navigation. There is also a robotic knee replacement, wherein a robot is used to make the bony cuts while the replacement is being done. These improve the accuracy of the knee replacement, but they are not always essential. Traditional knee replacement itself has done very, very well, and robotic is an additional refinement. Robotic or computer guided knee replacement is an additional refinement to the surgery. The results of non robotic and results of standard operations are themselves very, very good. So the robotic is not always necessary, and the results of traditional knee replacement are not inferior. So having said this, so this is a very, very successful operation. and a lot of people are undergoing the surgery these days. Our patients are getting older and older, and many of them want to have an active life, and this is a surgery that will change their life completely. After the surgery, patient has got improvement in the overall quality as well as in the overall, the pain as well as functional improvement uh, uh, with respect to the knee function. So anything more you want to ask me, you can ask me. How to avoid knee replacements. Now, this is a general topic in which basically, you have to keep your weight under control. Then uh, you have to keep doing exercises. Then strengthen the knee by doing physiotherapy, strengthen the knee muscles. Avoid high impact activities, avoid sitting on the floor, avoid squatting, and sitting on the floor with the legs crossed, that Indian type sitting. That puts a lot of stress on the knee joint, and if you avoid that, the stress on the knee is less, and it gives it prevents the deterioration of the knee in a rapid way. The night before the surgery, basically you are admitted the night before the surgery and you are in the hospital, unless the surgery has been planned that you come this day, the day of the surgery itself you are getting admitted. But most patients are admitted the night before surgery, and the night before surgery, generally the if the surgery is scheduled for say morning, early morning, the patient has to stay empty stomach. After 10 o'clock or 11 o'clock, he should not eat or drink anything. And you just follow whatever the medications have been prescribed by the anesthetist or by the physician. He has to keep taking them. And then usually the leg is dressed, cleaned and cleaned with the betadine solution, and a small dressing is put on the leg. That should not be disturbed. How can I avoid surgery in the future? Same thing, you have to lose weight, keep weight under control, and avoid activities that trouble you. Now, some people also have got bow leg deformity. Bow leg deformity is something where the knee is not straight. Now, most of the time the knee is straight like this. People with bow legs, the knee is bent to one side. The knee is like this, and these people, the wear and tear on the inner side becomes very fast and very rapid, and then these people, there is a preventive surgery for such a condition, wherein when the leg is deformed, you cut this bone and align it in the reverse way. I'm showing it on this model. Say you have a deformity which is like this. The knee is bow legged. When the knee is bow legged, you have problem that this part of the knee starts wearing out very fast. So what we do is we cut the bone below and give a reverse orientation. We change it like that. So the weight from this side gets shifted to the unhealthy side. The weight from the unhealthy side, part of the weight gets shifted to the healthy side, and so this can prolong the early arthritis. Some people get relief for 7 to 8 years. So this is called a realignment or a varus or a valgus realignment surgery for a deformed knee. But if there is no deformity, this surgery will not work. So this is one way of prolonging the life of a arthritic knee by doing a corrective osteotomy. When the alignment is bad, this operation gives you relief from pain for 5 to 7 years. At the end of which, again, if the pain becomes worse, you require surgery at that time. Yeah, during surgery, uh, the anesthesia is given, and we make a cut in front of the leg. We make a cut and we invert the bone. We remove the bone like this to one side, move the bone, the kneecap, then the knee is visible in front. the knee is visible, then what is done is, with the help of uh, cutting instruments, we insert a rod inside the knee, and then based on that, the cuts are taken. 8 mm of bone is removed from front, 8 mm from the end, 8 mm from the back, and from the corners also 2, 3 or 8 mm of bone is removed. It is fashioned to accept the prosthesis, which is checked on table. We have what are called trial prosthesis. We put a trial prosthesis and see, okay, it fits well. Same thing, we take a bone here, we remove the bone, we put a trial prosthesis, and we check that, okay, now this is moving well, and then we open whatever the trial size indicates. We open that size of the actual prosthesis, and the proper prosthesis is fixed with a cement, something called an acrylic bone cement. So that fits, and then this takes the shape of your knee. Like it becomes a original, like a, like this is a completed surgery. And then the closure is done, the wound is sutured, and a dressing is put, and from the next day the patient is advised to start walking. The surgery typically takes around 1.5 hours. This is what is artificial knee. This is an artificial knee. The knee replacement is a implant. This is a made of metal, and this is again made of metal, but there is a plastic articulation in between. And because this is a non-living thing, it doesn't cause you pain. So this is an artificial knee, or also called a knee implant or a knee replacement. This is what it is. Should I worry about anesthesia? Well, in most of the times, the anesthetist will come and have his own full evaluation. The anesthetist evaluates the patient, and if he has any doubts about the patient's condition, he will order the blood tests. He will order blood tests. He may ask for a chest X-ray. He may ask for a cardiology opinion. He may ask for an endocrinology opinion. He may ask for a physician opinion, and if there is any issue, those issues are addressed, and then the patient is taken up for surgery. Immediately after the surgery, in most hospitals, the patient is kept in a high observation unit, either an ICU or something called a HDU, high dependency unit. That the day of the surgery, the patient is kept for intensive monitoring, where they will be, checking the blood pressure every, hourly. They will be checking his temperature. They will be looking at the patient's vitals, and also painkillers and all that are administered on a round the clock basis. So immediately after surgery, the day of the surgery, most patients are in bed. They are mobilized the next day morning. The artificial knee lasts for, the most recent designs, most recent studies have shown that there is a 90 to 95% chance that the knee will survive for 20 years, barring catastrophic events. There are some things like infection, or if you have an accident, those are the times when the knee has to be redone. Otherwise, a regular knee replacement, once the initial period is, initial problems are not there, if it is successful, it will last for close to 20 years. You will be able to do all activities. I mean, routine walking, traveling, driving a two-wheeler, driving a four-wheeler should not be a problem. Climbing steps is not a problem. Some people are able to sit on the floor as well. Now, what we say you should not do is participate in contact sports like football, rugby, high impact activities, such things. The knee is not designed to last for a very long time if you keep doing these activities, because one of the components is made of plastic. One of the It's a very high grade plastic, but this cannot take high impact activities. This will start wearing out. So we get to see newspaper reports that the person ran a marathon after knee replacement. Yes, you can do all of them, but that will shorten the life of the prosthesis. So if the prosthesis longevity is a big concern, then you should avoid high impact activities. Contact sports, football and all that. They say light swimming you can do, light dancing you can do, cycling you can do, two-wheeler, four-wheeler you can drive, not a problem. But horse riding, running, jumping, contact sports, such things are better avoided. So, in summary, knee replacement is a very very successful operation, and it is being accepted by patients in a very big way. It's a life changing surgery, and it's to be done when patient has got severe arthritis, which is not controlled by other means, and the patient can expect to get rid of all the painkiller medications. There will be no pain following surgery. He doesn't have to wear any artificial braces or use a stick or any other devices. No need to continue with the exercises on a long term basis. Once the initial rehab is done, patient is back to normal. Certain things that need to be avoided are contact sports, high impact activities and extreme sporting events should not do. uh, there is complete restoration of the there is complete remission of pain. There is restoration of function. Any pre-existing deformities are concerned, and so the patient will have no pain. He will be able to regain his livelihood. He can seek gainful employment, and you can see a big improvement functionally as well as in the quality of life. So this is a very very successful surgery, and anybody who is seriously affected by knee arthritis should really give a thought to undergoing knee replacement. There's no need to be afraid that the leg is going to be the patient is going to be crippled, or the leg is not going to work at all. These are all myths that the patients are having. And again, when patient another myth the patients have, they think after 20 years what will happen. After 20 years, if the implant becomes loose, we can redo the surgery and put another implant, and that will also give good function. It's not like at 20 years you have to cut the knee or cut the leg. Some people have those misconceptions. So this basically, I hope that these misconceptions are no longer there. And in these days of social media and internet and all that, a lot of successful results patients themselves can look for these on the internet or with their friend circle. Among their friend circle, many would have had very very good results, and this is a very good surgery. Thank you.